Hello and welcome to the Corporate Facility Council's Wednesday webinar, COVID-2, Separating Fact from Fiction, the Sequel, presented by David Brinkerhoff and Wayne Whitzell. I do want to let everyone know that they have been muted for audio quality, and if you have any questions during the webinar, please feel free and type them into the question box, and we'll go over them during the Q&A portion at the end of the webinar. I also want to make you aware that this webinar is being recorded and will be made available on the Corporate Facility Council's website, ifmacfc.org. At this time, I'm going to go ahead and turn it over to Wayne, who is the Corporate Facility Council Secretary and Programs Chair. Wayne, the floor is yours.
Thank you, Joshua. Appreciate that. And I'd just like to give a special thanks to Joshua. Joshua and I have done a lot of webinars together, and Joshua and the whole components team has really helped our IFMA community adapt to this new reality with webinars and really make it seamless and easy for people that speakers we've had that maybe have never been used to doing that. And Joshua, you've always been really helpful to our council, and we just like to just extend another thank you to you and the team there for always being so willing to help. So thank you very much. I'd like to first of all start off with introductions here. Some of you who attended our last separating fact from fiction discussion are familiar with these two faces here, but I'd like to reintroduce David Brinkerhoff with Forensic Analytical Consultant Services. And before I even talk about anything else here, I always have to do this with people. David, will you do a quick little explanation as to what a certified industrial hygienist does, so we can set that bar?
Sure. Yeah, I think 20 years on in this industry, I think my wife, my family still couldn't give you the answers. So ultimately, very simply, we protect people. And we protect, that can be in occupational settings, that can be in community settings, but that's very general. I think the way I usually describe it is that we deal in the science of exposure. If you can be exposed to something, we can measure it, we can evaluate it, we can control it, we can protect people from it. When we talk about exposures, we generally break them into chemical, physical, and biological exposures. So chemical being, any chemical you can think of, formaldehyde in a pathology laboratory or welding fumes. Physical hazards could be things like noise or vibration, radiation, and biological hazards could be things like mold and moisture, could be things like bacteria, or could be things like viruses.
And David, approximately how many CIHs are there in the known universe right now? About?
Yeah, I think there's about 6,000 in the world. The Certified Industrial Hygienist is the highest level of certification in our field. So it requires significant education, experience requirements, and then you've got to take a really, really difficult test.
So this is even a more exclusive club than the CFM, which is our CFM study guides. That's an even more exclusive club there. So it's not just a willy-nilly designation that's thrown around. This is a lifelong commitment to get a designation like that. And so these are, you guys are serious, evidence-based, science-based, cutting edge, stuff. Okay, so I just wanted to get that out there. I look at you guys as like a meta skill. Like I used to do retro commissioning, and one of the things that I observed is that there's so many piecemeal solutions coming into an organization for things like energy strategy, but somebody's got to get above and on top of all of that to look for a cohesive plan that works together. And I really look at the IH as that individual, or that part of the team that looks at all of these solutions that are coming in and saying, well, let's take a look at these to form a plan that makes sense, both safety and financially. So thank you for that. So quickly, you guys all probably know me. I'm Wayne Whitzell, EVP with DFS Green. I lead our wellness division, which is our workplace health division. So this is a really interesting time for us. Obviously, this pandemic has really changed some things for us. And I decided that throughout this, one of the things I want to do is really bring in more IH content into what the CFC is doing. So what we've actually done is there's going to be a spin-off series starting in June that's quarterly on content from an IH. Joshua, I'm getting a little bit of feedback. That might be your line there, just FYI. I'm hearing some over talk. So the IH series that we're starting in June is going to be a quarterly program which delves deeper into what an IH does in major areas and how they can help you as an organization. So keep an eye out for that. That's coming soon. And then lastly, if you have any questions, please enter them into the chat window. Okay, that's where we're going to circle back at the end of this and deal with some of those. So why are we doing this? Well, David and I are taking a look back over the past year, because a lot has changed. And between March and May, we were doing a lot of presentations to try to help FMs get a handle on this. And David and I have been talking and saying, man, there's some things have really changed. Some things have not changed. Some things have gotten maybe even more aggressive in certain areas. And we wanted to kind of go back and review all of those things and see maybe where we were on point, where we were wrong, but also take a look at some emerging issues and technologies and really get David to put his futurist hat on and look at maybe where things are going. One of the things you'll hear with David, and I've learned this, I'm not a black and white thinker myself. I like the gray area, but David, as an IH, you ask him a question, he'll say either it depends, or he'll say as of this moment, the comma, and that's proven to be so true during this year, because we've seen some things that fall right into that framework. So I encourage you to adopt that lingo with your internal clients. You probably do already as FMs. That's part of the psychology of FM, right? But keep that in mind, that this is still an evolving issue in many ways. Some of it's settled science, some of it's evolving. So that,
with that, we should probably give the same disclaimer we gave during the our last discussion, which is this is a complex and evolving issue. What we do today is likely to be different tomorrow.
Yes. I mean, guys, when we signed on to this webinar, David was still looking on the websites from the federal government to see if anything had changed this morning. So that's what we're talking about. So I want to talk about last March. I did a webinar for the Corporate Facilities Council at the end of March that was the most widely attended webinar that we have ever given at the CFC, and it was because people were so desperate and hungry for information around this pandemic and what they should be doing. And we were shocked at the CFC. Really, we had thousands of views, and then AFE picked it up, and we realized this is an issue that people need more information on. But I want to tell you a little story. After I gave that webinar, someone posted it on IFMA Engage. And it was, people were saying, hey, this is very helpful, thank you, the usual stuff that you get on there. But I also got a troll, I guess you would say, or I got someone that was really angry at what I had said in the webinar, and it was pretty raw stuff. And if anybody knows me, I don't play the social media comment game. I just don't do that. I try to respond with love and openness to people. And I don't fight back on social media because I think it's useless. But eventually, this person got pulled off the platform for a minute and was warned, this is not what we do here. And I realized that there's a lot of people that were pivoting their services to try to generate revenue. And when some things that we say that maybe say, look, this might not be your best choice, people were saying, hey, why are you talking down what I do? And, in terms of things like coatings, which you'll hear more about that later. So people were, a couple people were really reacting that way. But in retrospect, it's obvious that it was an issue of they were trying to sell a service or a product to perhaps capitalize on COVID a little. And some of the things David and I talked about might have quashed that a little. But it was interesting to see that reaction. I've never seen something like that on Engage before, and nor since. So it was definitely a hot topic. So that's why we want to revisit this. And David, I think the idea that concerns me is that right now during this pandemic and going forward, our service providers and product manufacturers and everybody that touches a facility, are they creating this reality that we're walking into, the new reality, or are they responding to a reality? And I know that's a black and white statement, but where does it fall in there? Do you see it leaning more toward one way or the other? What's your impressions from everything you're seeing?
Well, there's a lot of technology solutions out there in the marketplace, and I think a lot of people are looking for simple solutions because if we can do something to our buildings to make this a little bit better, make it go away in some way, that's great. We're happy to do that, right? But I think what's really important is that the ultimate solution is controlling people. Controlling people is the hardest thing to do. It's easy to install a bunch of coatings or do something with the HVAC system, but getting people to change their behavior is difficult, but ultimately is the most effective thing. Maintaining our distancing, wearing our masks, washing our hands, those are the things that really reduce risk. All these other things can supplement that, some things to greater extents than others, but none of them are magic bullets that make all this go away.
Yeah, and there's so many parallels between this and the green revolution that happened back in 2007-8, where everything was being greenwashed. You know, we're a green doorknob manufacturer. Well, I mean, we started, that was no exaggeration. I started collecting photos of that, but we're seeing, have seen a lot of what I would call COVID washing. And I understand companies have to pivot in some way to generate revenue, but are they looking for short-term, solutions here that eventually are going to come back to bite them? I think what we want to do is add clarity for the FMs and separate that fact from fiction wherever possible. But on the whole, and you're seeing this on Engage too, the FMs, in IFMA are very savvy. And except for maybe that early phase where everybody was kind of, acquiring knowledge and getting their hands around this, you talk with people, they've got a big handle on this. There's still a few exceptions. I still poke my head into some chapter meetings around the country and still hear some people that maybe are talking about issues that were kind of solved maybe last spring or summer and changed, and now they're still talking about. There's still those holdouts, those people, but for the most part, I've been very impressed with the facility managers' quick agility and adaptation to these things. So we're talking with a savvy crowd here today, David. So big question for you, David. What do you see as the major changes since our discussion last year? What if you had to, number 1, 2 things? What do you think?
I think the biggest changes are our understanding of how this disease is transmitted. Right, early on, everybody was disinfecting their groceries and their mail. We didn't put a lot of thought into aerosol transmission. So I think since that period, we now understand that aerosol transmission, meaning really, really small drops that can stay around in the air for a lot longer, can be important, which that moves us to think about HVAC systems and that kind of stuff. And that also transmission from surfaces is probably not very important. We don't have any strong data that allows us to say you can't get sick by touching a surface, but we also haven't seen any evidence that anybody has ever gotten sick by touching a surface. So this idea that we need to, disinfect our doorknobs every hour, probably not based on the science currently. I think the other big change we've seen is we've gone from a lot of guidance documents. Early on, we're getting guidance from CDC and AIHA and ASHRAE and CDPH. All these organizations are putting their guidance in. At least at the state level, we've now seen some of that guidance turn into regulation. So I'm in California. Here in California, we have the emergency temporary standard, which takes a lot of that guidance, now makes it a requirement for employers. And we've seen that also with some of the schools. They've got now very detailed requirements. So we've kind of moved from this, I call it kind of qualitative to quantitative, right? We were talking about a lot of general stuff previously. Now we have a lot more specific requirements that employers or building owners have to follow to get people back into buildings.
So as an FM, I think it's imperative that we understand what falls into the compliant box and what falls into the, maybe you should do this, shouldn't, it depends box, right? But definitely checking that compliant box and ensuring that you are in alignment with whatever state standards are there. And then, of course, whatever your own IH or EH&S team has determined is necessary for your org, and to do that. Because I think early on, one of the things I saw that FMs got their hands around is they were engaging us and folks like you to help them develop their response plans and have that in writing, because you ask any CFM, you give them a scenario and say, what would you do if you had an active shooter, or what would you do if you had a hurricane, or what? The answer is we'd follow the emergency response plan. And so they needed to build those out. So I was very heartened to see that many folks were getting those things aligned. But I would definitely encourage anyone who hasn't really looked at their state standards or even checked them on a semi-frequent basis, because you look at our counties in California, you can drill down to county requirements that differ from county to county. So I would just encourage you to check that out. And again, that's something NIH can help you with as well. They're on top of that all the time. So let me ask you the next big question here, David. So disinfection. So you mentioned surface transmission versus aerosolized transmission. How have the recommendations changed in the last year, maybe from the CDC, in terms of disinfection, the process?
Yeah, so I think we're starting to move away from this routine disinfection, and there's more of a focus on cleaning, right? If we think about our hands, right, we use soap and water to remove the germs from our hands, and that's actually preferable to putting alcohol-based hand sanitizers on them. So it's kind of similar with surfaces. Cleaning's good. Routine cleaning needs to be done. Some of the state and local guidance still focus on a need to disinfect in addition to cleaning on some kind of regular basis. But we're seeing, particularly in the schools, they're now saying routine disinfection is not necessary. I think that's coming from not wanting to expose children to all these chemicals. We're seeing all kinds of chemicals being used out in the world, and some of them are pretty benign, things that are thymol based, based on plants, pretty benign. Some of these things, the quatermoniums, these are pretty heavy duty chemicals that can have pretty significant risk to people exposed to them. So, like I said, in the schools here in California, they've gone to guidance that says disinfection is only needed if a sick person has been in the area. So that's pretty consistent. If somebody's been sick, they're in the area, yeah, do some kind of cleaning and disinfection. But I think we're moving away from wiping down the doorknobs every hour with our Clorox wipes. Also, when it comes to disinfection, there are some challenges that I think many people in the industry are not aware of. At least in one county here in California, we're seeing enforcement from the pesticide folks, the people that regulate the application of pesticides, and they're saying if you as a business owner are selling a disinfection service, that falls under the pesticide rules. You've got to be a qualified applicator of pesticides, which for a lot of the companies that are doing these types of cleaning, that's a really high bar to hit. These are companies that are used to, they're excellent at cleaning, but they're used to working around sewage or mold or asbestos abatement, that kind of stuff. And they're not pesticide applicators. They don't work within those regulations, and maybe they need to. That might be a requirement that's being missed.
Well, that's a good point to reiterate for folks, and we'll touch on this a little later, but a lot of folks don't know that the list N products are pesticides. That's how they're since the EPA regulates that section. And there's really nasty ones on that list, and there's ones that are semi-nasty on that list, and some a very few that are pretty safe, that have good PPE guidelines and so forth, but they're still regulated as pesticides. So I know a lot of folks initially didn't know that, but we'll talk about that in a second. But I think two areas where I definitely had to get my mind right and change was early on in March or April. I think it was March. I saw a study, and I believe I saw the CDC attached to it somewhere, that they were saying COVID had a 19-day surface life at that time in March. So, this is like, think about that ripple effect that would have for FMs. Holy cow, I've got a 90-day surface life to deal with, and we didn't know. So it's something like, do you plan on adjusting your protocol to deal with a 19-day activity or not? But they that quickly changed, and I want to say in May or April or May, they backpedaled that and went down to a 6-day and then a 3-day. Yeah, go ahead, David.
There's been a number of studies. Most of them are sort of done in the laboratory, not in the real world, or that they don't look at viability of the stuff. They may find fragments of RNA on a surface 19 days later, but that doesn't mean that those fragments can necessarily cause infection. So that's definitely an evolving piece of this science.
Well, that's so I know this because I've had this conversation with you about this stuff, offline, because I engage my IH when I have questions, right? I go to the scientist. And I call it the Mythbusters method. For those of you that might be familiar with that TV show, or not familiar rather, is they try to bust urban myths, and they try to see if it's actually the truth, and if it's not the truth, if they can't say, oh, this didn't actually happen, then they create the circumstances to make it happen. So I see that with a lot of these studies. It's like they create the perfect environment in a vacuum, in a lab, with the perfect humidity, the perfect whatever, and say, let's see how long we can get this thing to last. And then it only lasts in trace amounts of RNA, and then they can say, look, it lasts 10 days, but it's not realistic. But if you just read the article and you didn't have somebody explain to you what they did, you could seriously spend a lot of money and worry about that. I think the other thing that I definitely have changed my mind on is I was very concerned in March that we were seeing all the medical personnel in donning full PPE, masks, respirator, everything, shielding, everything, and then the CDC guidelines for dealing with an active case were a gown and gloves, and basic masking. And I said to myself, gosh, how can I reconcile the fact that I'm sending folks in and myself into these places with active cases to do remediation, and yet if that same person went into the hospital, look at how they're going to dress. So I was saying, look, I'm treating this like mold until I get other guidance. And sure enough, we ended up getting some more clear science and studies and talking with your folks, and realized that no, we don't need to be suited in Tyvek to deal with an active case. And I think what we saw was a lot of folks kept continuing dressing up in Tyvek for active cases for one of a couple reasons. Either it was a little bit of theater, or it was the products they were spraying were so gnarly they had to protect their people. Yeah.
Yeah, and a lot of the people doing that work, there's a lot of unknowns going into those kind of environments. So the tendency is to default to a higher level of protection.
Yeah. Yeah. So you mentioned the requirements for applying disinfectants. I just want to touch back on that again. So there are required use or restricted use rather pesticides. So this is a perfect segue. Okay. Now this is where I'm gonna tell my FM friends here the area where you didn't do such a good job on the whole.
Okay.
So I have only had out of the, I'm gonna probably between 1,000 and 1,200. I stopped counting sites that we've done this year with active cases and sampling. I can only remember 3 that actually asked me for an SDS, and no one ever asked me for a label, a product label.
Yeah.
And in fact, the reverse happened. I would find out what their janitors were using, and they wouldn't know. So they pull the SDS and we go through it together online, and they were horrified as I was reading through. Look, are they wearing this PPE? Are they spraying it near people? Are they wearing the PPE? Are you aware of the storage issues with this? And we saw, deer in the headlights for a lot of my FM friends that had not done that. Now, some of you probably, looked at those things, but in my experience, I was never asked, except for those handful, I want to say about 3 times, I was never asked, hey, Wayne, what are you guys spraying? What are you using? So that's one of the things when you guys do your presentations for us starting in June, your quarterly, one of those pieces is going to be, how does an FM read an SDS sheet and product labeling? So that you get a grasp on that. What's your impressions on SDSs and labeling and what you're seeing out there?
Yeah, a couple thoughts. So all the list N chemicals, this gets really complicated. All the list N chemicals are not registered use pesticides at the federal level. So federal FDA, people that regulate these things, they say these are just sort of normal things. You got to follow the label, but you don't have to be, a special applicator. At the state level, that becomes very different. In many states, the things on list N are regulated as pesticides. But the thing that's the 2 important things is that the SDS is there to help guide how to protect yourself, how to dispose of this stuff properly, how to protect the environment. The labels on these products, those are not suggestions. The labels are requirements under federal law, and you are not allowed legally to use them in a way not specified on the label. So one of the things we see a lot of is, are these chemicals being either fogged or applied with electrostatic precipitators? That's fine if it's approved for that use on the label, but many chemicals aren't. We saw recently one, a contractor, they're just used to using their sprayers, and they, whatever happened at the warehouse, the product got switched, and they're fogging a quad ammonia product that, is, you can't do that per the label, and, causes a lot of odor, a lot of irritation issues. So it's really important. Those labels are gospel. You have to follow the instructions on the label.
And David, that even extends to the dilution. If you over dilute the product, you're off label and therefore violating. And because there's an expectation that it's going to produce a result. And if you say, we're running low, we need to finish this job, let's cut it in half.
Yeah.
Then you're doing pure theater, but you're technically violating the label. You're off the term off label at that point. So yeah,
those are the big federal guidelines, right? Those are the ones that come with big fines if you're ever caught.
Yeah. So let me delve a little bit into this next section here. So one of the things that we've been doing a lot of, especially this past year, we've been doing this for a few years in advance of the pandemic, but we do testing behind your janitorial to test efficacy. Are they producing the results that they're supposed to be producing? A lot of folks are spending more money on FTEs to do disinfection work, doing, like David was saying, doing those doorknobs every 15 minutes, or spending a lot more money on chemistry, on chemicals. And is it producing a result? So here's I'm going to pull back the veil and tell you guys, of all those 1,200 sites, and I did most of those personally, the vast majority of those. So I'm not. This isn't anecdotal. This is my eyes. I only went into one client site where I'll two. One was a medical building, but I'll take that out for now. In a commercial office setting, only one of those was actually meeting the standards of disinfection. One. And I'm not saying, and most of them weren't just a little off. Most of them were way off in terms of the sampling that we did. So we started doing observations. We started parking in facilities and observing, what the crews were doing, and finding patterns and seeing where things were maybe slipping. And this is my gospel lesson. Other than the SDSs, here's my thing. This is an issue of process, not product. If you follow the process properly and your janitorial teams are trained to follow the process, you will get efficacy, you'll get results. But here's what we saw. We saw janitorial companies switch out this cleaner for this disinfectant and said, go to it, and now you're disinfecting. And we would do the spray and wipe. But here's what I saw. And those of you who have lobbies that maybe were dirty and maybe examine why my front lobby is always so dirty. What we were seeing in restrooms is we were seeing a lot of janitorial folks. And this isn't everybody, but this is enough for me to say there's a pattern. Would clean the back of the restroom and work their way forward, and the very last thing they would clean with the same cloth and that disinfectant would be the door handle. And the numbers we were getting on those handles as you exited a restroom were astronomical, more than I've seen prior to the pandemic. And so I think people got in their mind, this is a disinfectant, it's magic, I just spray it on and it works. But it was actually in some ways causing the numbers to go up. And kitchenettes, just FYI, of every place that I've sampled in facilities, every place, the kitchenettes have the highest numbers in terms of activity or potential activity on those surfaces in there. And when I go into a kitchen and I test, say, a refrigerator door handle, and the numbers are astronomically high, then I say to myself, okay, this isn't something that just happened in today's use. This is a systemic problem. And the tabletop, why is the tabletop, off the charts where people are sitting? They're being touched more with the same cloth that's being used for everything, and they're just spraying quick and wiping, and they're not cleaning. So that's, to me, has been a tremendous issue, and it's this firsthand observation that I've seen. And I'll bring David in here. Is there's a lot of hygiene theater. I did not come up with that term. I think someone at ISSA came up with that, if I'm not mistaken, but I love the term. But we're seeing a lot of hygiene theater, which it's not really doing anything or doing much, but there is an optics issue to this, David. There's an issue where people can wrap their minds around seeing a spray bottle with product being sprayed versus some unknown thing that's happening in their HVAC or air exchanges. Can you talk to me a little bit about that issue of optics and how an FM can maybe get their hands on that and maybe use that to their advantage or quash it somehow?
Yeah, and just to go back a little bit, we've seen the same thing. We've overseen tons and tons and tons of these cleanings, and it really is about, you've got to clean properly first, and then you've got to disinfect, and you got to do it at the right concentration. You got to maintain the right contact time, and if you do all those things, you will get reduction on the surfaces. You'll be doing what you think you're doing. But yeah, dirty rags, all those issues are big problems. As far as kind of the second part there, yeah, people want to see things, right? I mean, if they see the UV robot, moving around the building, or they see somebody applying chemicals, they feel like, they can see it with their own eyes, right? They don't have to trust that their employer is doing the thing. Whether the thing that's being done is doing much or not doesn't seem to matter as much, right? But what they're really focused on is, is that thing that I can observe. And I think that just points to a need for more proactive communication. I think as building owners, as employers, it's really important to be proactive in the way we communicate what we're doing to make people safe. Nobody wants to go back to work, right? Nobody wants to go back into the buildings now for a couple of different reasons. But I think if we can proactively communicate that, listen, we've engaged experts to evaluate our HVAC system, to increase our filtration, increase our outdoor air, and then maybe follow it up with some sort of data, some sort of validation that, this thing we did is doing what we expected it to do. I think that can go a long way in making people more comfortable, going back into these environments.
Yeah, this unfortunately, we can do all this in our organizations at the FM level, but the person leaves and they go to Kohl's department store. I was there the other day, and they had just bottles of this stuff at every cashier, and they're just gushing it all over in between every single customer. And this is the big worry for me, is this massive overuse of disinfectants. And we're not at full capacity in most of the places in the country. So we're going to be expecting more of this being used. And we're starting to just barely see things bubble up with asthma issues. Now we're hearing more about asthma issues coming as a result of overuse of, or even just the general use of quaternaries or some of these high powered list end products. I mean, asthma is one thing, and there's minor health issues that come. But what do you foresee about David, about this overuse of chemicals in our facilities? What, if you put on your future crystal ball look, what do you see happening?
Yeah, I think we're going to see it retract. I mean, I think over the last decade, we've seen a lot more going back to kind of the green chemicals and things. We've seen a lot more interest in green chemicals, reducing our exposure to chemicals, reducing off-gassing and building materials. I think as people start to understand that this massive disinfection probably doesn't do really much or anything to reduce the actual risk, I think we're going to start getting away from it. Nobody wants to be sprayed with bleach when they go into Kohl's, right? And the reality is, it probably doesn't make anybody any safer.
Yeah, I think the EPA's got to come around a little bit, or the CDC, because this is the mind-blowing thing for this, is that there are safer alternatives to the list end pesticides, but they're not regulated by the EPA because they're not pesticides. The actual safer things that have independent kill claims for emerging pathogens that are not pesticides are not recommended by the CDC. So I think we've got to maybe come around a little and start looking at some of these things as an alternative to get away from those. What do you see there? Do you see the CDC adapting that, or are they firmly entrenched in promoting the pesticidal solution?
I think if you dig in deep enough, they do say it, but I think it's a matter of focus. Everybody's heard of list N, and everyone's reading the headlines, not the study that that supported that headline. So I think if you dig in deep enough, CDC, others, they do talk about cleaning, but soap and water is effective at removing these things from surfaces. We don't need to kill everything on the surface. if we can remove germs from the surface using detergents and water, it's the same thing we do with our hands, right? And we don't dip our hands in bleach to clean them. We wash them with soap and water because that mechanical action with the surfactant is effective. That works.
Right. Yeah, that's kind of the kind of dark secret here, is that if we as a cleaning industry were doing what we were supposed to do all along, with actual just cleaning the organic matter and biofilm off of surfaces, we wouldn't need to engage the disinfectants at nearly the same at the level that we're trying to do right now. And I think some of these safer alternatives, I think I'm going to show you guys an example here. Let me see if I can pull this up for you all to take a look at here. I'm going to share my screen here. So we've been testing a variety of technologies in some cases for a few years. This is Aqueous Ozone. We're pretty excited about this as an option for folks. Not only can you get rid of all but just about one of your cleaning chemicals, you still need some form of degreaser, but this is the ability to replace all your chemistry. They have independent kill claims against emerging pathogens. But what I like about it, because we've been testing this since about late 2017, I think. What I like about this is that when you clean with aqueous ozone versus a regular cleaner, you really understand what biofilm is, because aqueous ozone removes the biofilm. So when you spray something on a surface, it gets this kind of surface tensiony kind of look to it that you never see with a regular cleaner, because it has actually removed the biofilm. And we're getting great numbers with this solution. So this, and here's the nice thing about it, is aqueous ozone is water. So we have some clients here in California that have on-site recycling of water. So they actually regenerate that gray water on site, and you can't put down into that gray water surfactants and some of this other stuff that people dump cleaning products into the waste stream. This becomes water again in 24 hours, and it's very safe. And there's those independent kill claims, but they're not something that's on list N. So what I end up recommending to people, David, and tell me what you think about this, is I say, look, if you have an active case in your facility, you want to use list N because that is the CDC guidance, and you want to be able to check that box that you follow that. However, I would only use it in a very restricted area, path of travel perhaps, or where that person was. There are FMs out there I work with that we've done a lot of jobs where FMs have an RFID badge system set up where they give us a heat map and we can see where the people went. That way we don't just willy-nilly go through and blast the whole place, but it's targeted just in those areas. And then if you're just looking for preventive disinfection or disinfection outside of that, is I would go with a safer alternative that perhaps is not list N. Now, am I off base in that solution? Are there any improvements to that you could see?
No, I think that's reasonable. I mean, I think the guidance is pretty consistent, right? If we have somebody sick in the environment, let's clean the surfaces in the environment. I think it's important to remember that we're talking about cleaning the surfaces. I still see a lot of people just walking down the hallway fogging chemical, and I think that's something to be avoided. Probably doesn't get us much from a risk reduction standpoint, and can create pretty hazardous conditions for people exposed to those chemicals. But I think we're moving towards a focus of routine cleaning, specialized disinfection, right? Disinfect when there's a sick person, but keep up your routine cleaning. Maybe we add to that some disinfection of real high-touch surfaces. The front door handle where the public and employees and everybody walks through. Maybe we get that on a disinfection schedule. But another important thing about all of this is if everybody just washes their hands, we don't need to worry about surfaces as much. So again, going back to the people part of this, I think we're making a lot of progress there. But washing hands, if my hands are clean, I don't have to worry about the surfaces too much. And even if the surfaces are dirty, if I wash my hands, I don't have to worry about infection.
Right. Yeah, that overuse of the fogging and so forth and electrostatic spraying, it's been interesting. As a company that does disinfection work, and I had a conversation with a remediation company that's very skilled and very good at this also, and we tend to be Boy Scouts about this stuff and say this is the way. If you want to pay us to do disinfection, we will do disinfection. But when it becomes commodified, and you've got, say, the janitorial industry saying, oh, we can just add this for 2 cents a square foot.
Yeah.
And you say to yourself, what are they? They're doing a blow and go. And then we say, okay, well, we can do a blow and go if that's what you want, but it's optics in some cases. Unless you're doing touch points, pre-cleaning, and doing some sampling before and after, you really don't know, and it's just to make you feel good that we did something. And that comes at a cost. The overuse of chemistry, it comes at a cost financially, obviously, but that cost is being driven down. Early on in the pandemic, we were seeing people getting $5 a foot, which is ridiculous.
Yeah.
You know, I mean, that was ridiculous. And then, you know, kind of settled in that, you know, maybe 5 cents to 20 cents a square foot kind of was what we were seeing in there, sometimes 30, but it's been driven down, and it's just been an add-on to our janitorial industry friends. And you know, bless their hearts, we're putting this equipment and products in their hands and telling them just to go out and spray. And I just think we need to dial that back a little and focus it, and not have to overuse the products and put people at risk.
Yeah, and just to put a little bit of perspective to this, right? We know a lot about disinfection from the healthcare industry, and nobody's suggesting we need to treat, you know, somebody's lobby like a patient room. But when EVS goes into a patient room to disinfect that room after a patient, it takes them usually about 40-45 minutes to disinfect one patient room. I mean, that just kind of gives you a little bit of an idea of what real disinfection takes. It's a very detailed process that requires pre-cleaning and contact times and good understanding of the chemistry and a really detailed approach.
Yeah, I'm a CEST. I took that test for that, and that's where I really was hammered in my training, that it's process. There's you can replicate this process and follow it, and if you follow the process, you can guarantee results. But if you miss anything in that process, you're not disinfecting. Okay, and you have to decide: am I doing this for optics, or am I doing this for disinfection? And if so, is it necessary? So let's make a shift here. So, how important is the HVAC system in reducing transmission? I mean, obviously that's something you guys spend a lot of time on. What are your thoughts on that?
Yeah, the quick answer is probably pretty important, right? Again, our primary controls are the people, wearing the mask, keeping the distance, washing hands. That's the most effective thing we can do. When we start talking about the building, what we can do to the building, I think HVAC is probably one of the most important engineering controls we can talk about from a building standpoint. And what we're really talking about is bringing in more clean air, more filtration, more outdoor air. So we can do that in a bunch of different ways, you know, looking at filtration and you know, looking at our outdoor air dampers, bringing in portable HEPA units. But I think it's pretty important. You know, we still don't see really almost any documented cases of people becoming ill from something moving through the HVAC system, right? But what we do see is that as people go back in the buildings, the viral load of the space is going to increase, and the more air, the more fresh air we can bring through the building, the faster we can decrease that. It's not that different than, you know, when we, from a sort of indoor environmental quality standpoint, we're looking at carbon dioxide, right? As we put more people into the building, if we're not moving enough clean air, enough outdoor air through the space, we start to get a buildup of carbon dioxide throughout the day. So it's kind of a similar approach. We want to move as much outdoor air, as much clean air, as much filtered air through the space as we can. But we want to do it in a way that doesn't disrupt the way the system was designed. You know, there's a lot of kind of add-on technologies, a lot of things, a lot of changes we can make that may actually make these systems less efficient, right? By creating dead zones that don't get cleaned, or by moving air throughout the building in a way that it wasn't designed for.
I think this is a perfect marriage between your HVAC vendor and an IH. Because, you know, this is definitely something like, for example, you're not going to bring in as much outside air in the summer in Sacramento as
Yeah.
you would, in Poughkeepsie, New York, right? It's going to be different, because you're no longer going to be in that comfort zone that you have, because you're now going to have to cool, and you can only cool that outside air to a certain amount. So there's math. There's a lot of math involved in this that your HVAC folks are going to have to help you with, and there's a cost, especially in places where energy is so expensive, like in California, to do this. There's a significant, for big buildings, it's a huge cost, and I think an IH can really help you dial that in, because, like I said at the beginning of this, the IH gets above and on top of all the vendors, and it when piecemeal solutions come in, you can have a real fox in the hen house mentality, where you've got somebody pushing something on you that might not dovetail with another thing you're investing money in, and really I think it can help have somebody take a look at all that. But I do want to mention, we did a webinar, the CFC, last September, called Building Design Responses to Mitigate COVID-19. You guys can go back and look at that on the IFMA CFC site, where we actually go through all of the different solutions, bipolar ionization, UV, et cetera. So what are you hearing, just quickly, David, about those two things? Because those seem to bubble up the most as two of the most popular.
Yeah, again, a lot of people are selling, technology solutions. A lot of people are buying technology solutions. I think it's a little bit buyer beware. Bipolar ionization is one where I really think the science, is the current science does not really support this being a very effective tool. There's a lot of studies out there. Some of them conflict. I was reading about this just this morning, and for the most part, I think the claims that are being made aren't ultimately met. With UV, there are some good applications of UV. Upper room UV has a very long history, and can provide some value. I think if you're trying to use UV in an airstream, obviously there's issues with contact time, right? If I've got air zipping through a duct, does it come into contact with that UV light for a long enough period to do anything? And I think the answer to that is maybe. With UV, you've also got issues if you're going to use, like, say, the UV robots, right? That's another one that you turn on the robot and it zaps everything in the room. With that, you've got safety issues, you've got issues with shadowing. So, if I set up that robot on the other side of my laptop computer right here, I don't get disinfected because I'm in the shadow, right? So there's those issues. And again, with UV, at least as it's applied to surfaces, again, I don't think, the risk of transmission is really coming from surfaces. It's more droplets or aerosols.
Right. So I mean, it's interesting. We're not talking about staph or MRSA, where we've got a surface issue that's a little bit more worrisome, like a wrestling team, laying on the mat, it can go through them like wildfire, or through the locker room because of that contact. But we're dealing with a different type of pathogen here, where the primary means is through the air, direct contact. And again, one of the phrases I use is meat and potatoes. We're talking about meat and potatoes here. Wash your hands, wear a mask, social distance, and that's no matter what you do beyond that. It might be icing on the cake in some ways, or might help or enhance some of those perhaps, but you've at least got to get those things under control. And that's really, like you're saying, it's about controlling behavior. It's not about the magic bullets all the time, right?
Yeah, and I think some of these things are really expensive long-term investments. So I always suggest if we can make improvements to the HVAC system, in general, more outdoor air, more filtration is always going to be a positive thing, right? Unless there's wildfires outside and we're trying to keep it out, right? But that's going to help to not just manage infectious diseases, but also to make the space more comfortable, reduce carbon dioxide, reduce off-gassing from building materials. So we spent a lot of years trying to make buildings tight and HVAC systems energy efficient at the cost of air quality. And I think we have an opportunity, as we look at these changes, to look at changes beyond just what it's going to do for COVID, but how it's going to impact air quality and comfort in the space.
Yeah. All right, so at the remaining time, I'd like to talk about emerging technologies. And I want to tell you about our process as a company at DFS. So what we do is, when we survey the landscape and look for some of these new things that are coming out. We do internal testing before we do anything else. We bring the things in, play with it, put it in real world circumstances, and try it out, whatever it may be. And then the next thing is we bring it in front of a select group of clients. These are my close friends, all of whom are CFMs, and I say, what do you guys think? Shoot holes through this thing. Let me know what you think. And I also reach out to my CIH friend, David. So all throughout last year, I'm pinging David, what do you think about this? Did you see the study? What do you think about this? And of course, David goes in and says, well, you notice they didn't do a peer-reviewed study, and they've got this thing here. And, he's going granular and giving me data, or at least, hey, there might be something here, or this looks good. So that's why I love having my own IH buddy that I can reach out to. But I'll tell you, one of the things to me, and this might raise some ire from people here, is the coatings issue. So early on, I was saying, guys, we tested this stuff. We've talked to an IH. We've looked at the studies. We talked to some clients about it. We do not recommend investing this hundreds of thousands of dollars in these coatings that magically kill COVID for 90 days. And we actually had a big internal conversations at our company about this with my executive team. And I said, look, guys, here's the science. That alone is a reason why we don't want to do this. But can you imagine that 6 months from now, when this gets debunked or not recommended by the CDC, that now we're going to have to stare our clients in the face and say, hey, sorry for getting you guys to spend $250,000 on coatings, and when now all your friends are making fun of people that bought them. Because if you go on IFMA Engage, this is interesting, on our internal site, you're starting to see, or not starting, it's been for a while, people are asking about the coatings, and you see the long list of people saying, don't buy it, it's snake oil, whatever. And then folks that sold this are now having to backpedal to their clients. Well, you still have to do disinfection, or it never claimed to do this. And I'm just so glad that we're not in that position of having to look our clients in the eyes after selling them something that, especially now that fomite transmission is so low on this. So I think that I've been proven correct with some of this. The EPA has even spanked a couple of companies for making some claims about this stuff. And just basically, here's the thing. I put the real world smell test to it. If I coat my door handle and Susie sneezes in her hand and touches the door handle and walks in, and let's say 10 minutes later, 15 minutes later, Fred touches the door and then sticks his fingers up his nose, are you telling me that we can put something on the door that in that 10 minutes will deactivate that pathogen? That's some pretty gnarly stuff, if so, whatever that magic is that can do that. So in the real world, it doesn't even play, to me, it doesn't even pass that test. So I would just encourage you, if you have questions about the coatings, ask an IH and let them tell you from the science and look at the studies. It might have a kill claim, just like a quaternary disinfectant might have a kill claim, that it can actually deactivate it. But something that will magically do it over the course of 90 days, I think any FM that because I've had FMs ask me, Wayne, somebody pitched me this product, what do you think? And it's been more than a few. And I just pass on what David told me. I said, look, this is what we've discovered about this, and I don't recommend it. I think you be better investing that large sum of money in your HVAC. Right?
Well, I'll give you one more example of that. It's really important. You talk about the smell test, right? Talk about perspective. Is step back and really think about what we're trying to do here. EPA just a week or two ago came out with, and they added a copper, 97% copper alloys to their list N, right? And you start digging into that, and you go, okay, so if you've got a copper, faucet in the bathroom or a copper doorknob, they're saying you get a 99.9% kill in 2 hours. So, you're not talking about a 10-minute contact time. It's, a 2-hour contact time. But I had somebody ask me this, hey, should somebody's trying to sell us all these bathroom faucets. Should we change out to copper alloy bathroom faucets? And we start thinking about it, and we go, well, why don't you just do touchless faucets? So it's kind of, you gotta stand back and just kind of look at what it is you're trying to do. Look at what the risk actually is. Again, I don't think transmission risk is is very risky, and is it worth, spending a large sum of money to change out all the handrails and doorknobs? Probably not the best money you could spend. Maybe there's something there as part of a entire solution, but as a magic bullet, probably not.
Right. All right. Let me talk about a couple more emerging technologies we tested while I've got you here. So this is an R0 arc UV unit. And early on, I was not a big fan of UV for the same reasons you mentioned. Where does it make sense to do with the shadowing and so forth? But we brought this one in. And for those of you that don't know, R0 is a company out here in the Bay Area, actually funded by SpaceX and Tesla. So it's got some pretty strong backers out here. So we brought it in and put it through the paces. And I actually changed my mind a little on shadowing, David. So I want to get your opinion on this. But we actually brought this in front of a group of CFMs and talked through the usage for this. And where this would not make sense is in like high density benching. It just, the productivity and shadowing, I mean, all that would not make sense. But we've got a lot of clients with high turnover conference rooms, like 1,000 conference rooms in a building. How can they turn these over in 3 minutes safely and quickly, and with a unit that's very mobile and actually tied to a database that can record where it was used, so you have some compliance issues. But one of the things I learned about shadowing is that getting the right millijoules per square centimeter with these things is we can actually measure that. So light refracts and reflects and everything around a facility. So when we place these cards, we can actually see is the shadowing extensive enough that the areas we wanted to hit is not getting it. And I was pretty happy to see that in the areas where we tested it, we were still getting efficacy. Obviously not everywhere, like deep under the tables and so forth, but in those high touch areas, we were getting that. And I don't know, I'm just pretty bullish on this as a solution for those with high turnover areas with a lot of unknown factors. So conference rooms, restrooms, you can pop this in 2 places in a large restroom for 3 minutes and your restroom is disinfected and no chemicals. So this is something that I'm actually excited about seeing. We're pushing this technology, but I'm not going to say this is the magic bullet. But I will say I reached out to these guys and told them that I would be talking to IFMA today, and they gave me a special code here. If anybody wants to write this down, they're more than, you guys can reach out to them and use that code for more information, and they'll know that you came through IFMA to get to them. And then real quick, before I get your opinion on this, I also tested an arc air unit. And one of the things that I really learned in studying these, because you see these now everywhere, everybody's got portable units of some kind. And we have the catch and kill, filter and UV, or just the kill, which this is through a UV chamber. But I started reading and exploring the cubic feet that these things can handle. And if you look at a lot of these HEPA units, they only cover a very small area. And you've got people placing them in large elevator lobbies or lobbies that can only cover 100 square feet. And I've looked at some of the filters on some of these that haven't been changed. And I say, okay, this is ridiculous. So one of the things I like about this unit in particular is it's only a UV chamber. So you're getting better airflow through these things, and it's pushing it around, and you got about 500 square feet at a 10-foot high ceiling. But see, all this involves math. So if you know that math, now you can say how many units you need to actually get coverage. So I'm feeling positive about some of these technologies that are out here, in particular the stuff I've seen from R0. They have a good story, but I'm not so sure that you want to do you wouldn't promote these as a magic bullet. What are you seeing with these kinds of things, David?
They're tools in the toolbox. Going back to the UV, robot, that little dosimeter that you showed on the refrigerator, that's great, right? That's a way we can validate. I'd like to see that dosimeter on the back side of the refrigerator handle, right?
Right.
That's what I want to disinfect. And ultimately, I look at that and I go, okay, well, is it easier to set up the robot or just get my disinfectant? And if I want to disinfect the refrigerator handle, I just do it. It takes me a couple minutes. So there's conference rooms again might be valuable, but let's go back to what we're trying to do. Do I want to clean the walls in a conference room? No, I don't care about the walls, right? I'm focused on high touch surfaces. So I want to get the chair handles, you know, and the door handles and the table. And is, you know, that technology the best way to do that? You know, maybe there's some value there, maybe not. I think it depends on the use case. As far as the filters go, one of the things I like about HEPA, so first of all, to your point, yes, it's very important that you size those portable units for the room they're going to be used in. There's what's called a CADR, a clean air delivery rate, and every one of those portable units should have it on there, and it should say what size room you can use it in. One of the things I like about filters versus just straight up UV is that it does other things besides just COVID, right? When we get the wildfires and we get a lot of particulate in the air, the filters can capture that particulate, whereas with a UV device, that particulate's just going to cycle right through, right? And maybe even, you know, work to keep that particulate airborne even longer, right? Because it's just kind of throwing it in the air. So, you know, I still see HEPAs as kind of the gold standard, but you have to maintain them. You know, if the filters fill up, at some point they stop being effective, and you've got to size them correctly.
Well, we're at our 10 o'clock here, so I want to leave some time for some questions here, but I do want to point out we were talking about upper UV. I've got a photo of that here. This is a school. They put them in every classroom, and there's actually federal and state funding available for some of these things as well. But I thought that was interesting when I was touring a friend's elementary school and saw these up there, brand new school.
Well, I like the position of those because if you think about it, as we all sit in our classrooms, we're our own little heat generators, right? So our droplets, our aerosols tend to go up with the heat from our bodies. So applying UV in the upper portions of a room, you know, there's a lot of history of doing that, and I think there's the studies are a little bit more clear on there being some value with upper room.
Got it. All right. So Joshua, do we have any questions in the chat window?
Yes, we have a few questions here. Some of them we've already covered during the course, but one big one here is like, where can we get more info on Aqueous Ozone cleaning products and equipment?
You can reach out to me. I can put you in touch with some people I know that'll give you some straight answers. We're very bullish on it and have tested it extensively. So I'd be happy to talk with any of my IFMA friends about that. So you can reach me at waynew@dfsgreen.com. And depending on where that goes, I can point you to one of the manufacturers that are out there. And I'm trying to get, just so you guys know, I'm trying to get some of these folks to partner with us at the CFC as sponsors and so forth. So if we do show some interest from this webinar, that will help the CFC. So reach out to me, waynew@dfsgreen.com.
Another one here is, are there processes we can do ourselves in-house to check the effectiveness of cleaning?
David, I'll give you mine, and then you hop in on this. So I will say one of the things that's scary is an ATP meter, a hygiene meter, in the hands of somebody that's using it for either marketing purposes or as an audit, you know, against their janitorial, because you can get very swab happy with these things. And I can really dig in on my first test and say, look, it's 5,000. And then at the second test, I can go real light and say, look, I brought it down to 0. Unless you're doing this with a scientific rigor in a way that's fair, the fairest time to do one of these tests is immediately following the janitor's cleaning, immediately. And then that way you say, was it efficacious what they did? But this is an awfully expensive, you know, $2,500 meter, $250 to $3 a swab to test that stuff. So I imagine I would probably, if I was wanting to test, I would do more of a Deming. If those of you are familiar with Deming management, I would build quality into the process as opposed to auditing the process as much. I would say, let's do training. Let's train them to use the correct processes, sample as part of their training, and maybe do periodic audits. But we don't want to be running around as an FM with these after every cleaning and saying, you guys, the numbers are too high. I don't think that's fair. David, what do you think?
Yeah, and it's important to remember when we're using a luminometer like that, it's not measuring anything related to the virus, right? If you go back to your basic biology, You might remember ATP, right? Adenosine triphosphate, the power molecule in all living organisms. That's what that's measuring. So, it may be looking at bacteria or other living cells on surface, but it's not directly measuring virus, which does not contain ATP. So it's a surrogate. So that's one limitation. There are other things that have similar limitations. You can use things like glow germ, which is just a glow in the dark powder that you can put on surfaces and then come back with a black light and see if it's been removed or not. Again, it's a surrogate. That's actually harder. Glow germs are actually harder to remove than it is to kill the virus. So it may be too high of a bar for janitorial staff. You can even sample the surface directly for COVID RNA, but that takes time. It's got to go to the lab, and it may be several days before you get results. So there are different things to look at. I really go back, like Wayne said, to process. Are we using the right chemical at the right concentration with the right contact time? I think that's, if you do those three things and the surface is pre-cleaned, that's going to guarantee efficacy. So when I do this for clients, I generally don't do any sampling at all. I say, we're going to stand there, we're going to oversee your vendor, we're going to watch them dilute the chemical, we're going to help them focus in on the right surfaces to clean, and we're going to stand there with the stopwatch and make sure we get contact time. And that's, I think that's really the gold standard. Everything else is kind of supplemental to that.
On that UV real quick is that I've seen some FMs use the UV markers and then they go back and test and the mark hasn't been completely removed. To remove that mark in a lot of cases is very difficult. You want to see a smudge or that it's been touched, but to actually remove it, don't expect that to be the bar for a lot of these UV markers. It's that you want to check that it's been touched. Removing it is kind of an unfair standard to give to certain people. But I like UV markers. You can just do a little touch here and there on some. It's what it is. It's the parallel of putting the paper clip or the M&M on the carpet to see if the janitor's vacuumed. It's the same exact thing.
Yeah.
Anything else, Joshua?
Yes. Are the results from the study Wayne is discussing available for us to review?
I'm not sure
This
which.
is about halfway through the presentation.
So I'm not sure which study it might be on. I can go back and look at our notes and see if it's about the difference between fomite versus error. That's actually pretty well documented on the CDC site. And the Atlantic just released an article that cites a really good study. So if you search the Atlantic, that's one that I thought was very easy to understand in lay terms. But I think this is an example of why you need an IH. If you want to see some of that stuff, or you have a question, or you want access. I mean, David is, waking up in the morning with his coffee, looking at these studies as they come out. So David, if somebody reaches out to you about a need for a study or something to your organization, is that something you'd be able to help them with?
Yeah, absolutely. That's, particularly when it comes to COVID, that's a big part of what we're doing. It's just being a resource. We've written, dozens and dozens of programs for clients, but a lot of times it's just like, hey, I got this situation, what do you think? And so, as a company, we've got a group of experts that does nothing but COVID. And so, yeah, I think that's with so much information and misinformation, having a resource that's really focused on this, I think is one of the biggest values we can provide.
Yeah, and then skin in the game that you have. I mean, you guys have a serious reputation to uphold as the the Jedis of hygiene, but you don't have a dog in the hunt. Your dog in the hunt is the safety of people.
Yeah,
and
exactly.
that's it's more of you're going to get some more pure advice than someone who's maybe pushing a service or a product.
We call that integrity of the science, right? Our mission is to do the best science we can do every day.
And someone's asking, how effective is wearing gloves?
You want to take this, David? I got my own opinions, but I'd hear yours.
Yeah, no, gloves gloves are great, right? They keep your hands clean, but what happens when your gloves get dirty, right? So there's kind of two reasons we might wear gloves, right? One is we oftentimes should be wearing gloves when we're using these disinfectants or these other cleaning chemicals, because they can cause skin irritation. Some of them can even absorb through the skin and cause exposure that way. So as a way of protecting yourself from chemical hazards, I think gloves are an important tool of the toolkit, right? As far as using gloves for prevention or protecting yourself from COVID, it's a little bit less valuable, right? Because the whole thing is whether I'm wearing gloves or not, I don't want to go from here to here. So I can wear my gloves, but I should still wash my hands when I take them off. I should still not be touching my face because my gloves might be contaminated. Most of the time, when we're talking about COVID, just wash your hands.
And then this may have fallen over to the coding section, but we'll go over it just in case. Do antimicrobial self-cleaning door handle covers do anything?
Antimicrobial, I'm sorry, could you repeat that, Joshua?
Yeah, it says antimicrobial self-cleaning door handle covers.
Okay.
Do they do anything?
So basically, they're the little ring that goes around the door and will actually dispense a small amount of disinfectant onto the ring, and the ring will go over the door. If the everything meets the labeling of the product for that door handle, where in other words the ring leaves it damp enough that it's going to have the required contact time for the labeling of that product, it's just automating the process that a person would do. Now, is it cleaning first? Is it doing a 2-pass to say I do a clean and then a disinfect? Because if it's very dirty with organic matter, that may not be enough to actually disinfect it. So that would be something I'd want to test. That'd be something that I'd want to see how dirty can it get before it actually needs to maybe go over it twice. Because me doing refrigerator door handles, David mentioned those too. Those are gnarly in facilities. I've sometimes had to do 3 disinfectants of 3 10-minute dwells if it was extremely dirty and I didn't get all the organic matter off and it just kept dirtying up. So that really depends on the organic load that's already on the handle. Am I in the ballpark there, David?
Yeah, no, I think so. I wasn't exactly clear. The other thing I see related to door handles is sometimes you'll see the stickers that go on the push bars that are, some kind of, copper or other metal sticker that they're making claims that, it's, again, going back to copper, right? The self-disinfecting metal. And I think we covered that, but, same thing. Is it clean? If it's not been cleaned, it's probably not going to do anything at all. If it does something, it probably takes some period of time. I've read anywhere from a couple of minutes up to 2 hours to get a complete kill. And if, people are cycling through that door on a regular basis, it might not be doing much at all.
And then we'll go ahead and close it out on this question. They're asking for David's contact information.
So we're going to David, you can give your email in a second here. What I'm going to do, though, to let everybody know, anybody that attended the webinar, you're going to be getting an email with our contact information on that email for additional questions and how to reach us. But just, David, if you just, for this person, would you give them your email contact right now?
Sure. This is my nightmare because I have the longest email address in the world. But I have a special short one just for this. So it's dbrink, D as in David, BRINK, at forensicanalytical.com. And my phone number, 510-266-4600. You can get a hold of me that way as well. And yeah, I think we're going to follow up with an email as well. So.
Well, I'd like to thank
everyone.
Great.
Thank you.
Yeah, thanks, Joshua, for again for helping us out.
Thank you, Wayne.
I want to thank everyone for attending and have a great day. Thanks for a great presentation. Bye-bye.